Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of the Department of Medicine here at the University of Louisville. And it's my pleasure this morning for Cardinal Minute to have our guest, Dr. David Scales, who is an assistant professor of medicine at the Department of Medicine at Cornell. And he's talking about environmental impact of information and the toxins that we carry. I'm joined by Dr. Justin Kingery, who's a colleague from his time at Cornell with Dr. Scales. Justin Kingery is our Associate Program Director in Internal Medicine and a great colleague of Dr. Scales. So, Dr. Scales, can you give us a 1-minute summary of your very informational Grand Rounds?
I'd be happy to. It's an honor to be here. Thank you so much, Dr. Williams. So in summary, what I would say is information environments are a fundamental social determinant of health. There's a lot of discussion right now about misinformation. Misinformation, the Surgeon General defined as false, inaccurate, or misleading information based on the best available evidence or scientific consensus at the time. And I think that's an important view, but it's really only one piece of the puzzle. There's a lot that we can do as medical and public health professionals to apply medical and public health frameworks, like an environmental framework, that helps us address the larger issue, not just of misinformation, but of how information becomes distorted as it traverses our information ecosphere. Now, we've seen a lot of patients that present in the hospital or in the clinic with medical misperceptions that can sometimes lead them to health decisions that are not commensurate with their health goals. And that's the moment that I really feel like we need to be thinking about interventions. And interventions can include things like simply having a discussion to try to understand what sources people believe are credible, how they discern between high quality information and low quality information, and sitting down and working with patients to try to help them understand kind of what really can be high quality information or low quality information. Because I think some of the best evidence that we have about effective responses at the point of care show that if we can detect when patients' medical misperceptions are leading them to health decisions that are not commensurate with their health goals, we can do a lot of things. And the best evidence is behind motivational interviewing. Motivational interviewing has been used to work with people who have substance use disorder, who also are engaging in health behaviors that are not commensurate with their health goals. And developing kind of those relationships over time is really crucial to ensuring that we can not try to twist people's arms or not try to kind of brainwash people, but really just try to work with people to try to make sure that the information that they're consuming, the information that they're exposed to, and their health decision-making is ultimately commensurate with their health goals.
Well, it's a large challenge. I'm glad you're looking into it and hopefully developing all of the mechanisms that we need to get the right information in the right hands at the right time. Really appreciate all that you're doing in this space. And for everyone else, we will see you next week. This has been a Cardinal Minute.